Have you heard of a Foley bulb induction? Tell us in the comments. Gotta say, these are newer, like maybe started in the last 8 years or so. But studies show they can decrease your overall induction time if you need cervical ripening. But a lot of it doesn't make sense to you. You think like a Foley just goes in your pee hole. How does it even work here? So let's talk about it. The ones I've seen placed use a Cook's balloon, which looks like this. So it's kind of like a little two-part snowman at the top of it, and they insert it, and I believe, because nurses don't place them, but your cervix goes in this little groove in there so that it doesn't slip out, but it still expands. Some places use something more like this, where that blows up and pushes against your cervix. So this is just like a regular Foley catheter. Normally, if this is put in your bladder, that little balloon right there helps cold it into your bladder. Side note, when you hear us use the word catheter, it just means tube in the hospital. The IV is a catheter, your epidural is a catheter, your P is a catheter. This is still a Foley catheter, although when we put it in your cervix, nothing's going to be draining out. So the idea is this is a very mechanical thing. So we put in the catheter when it isn't blown up, and then once it's in the right place, we blow it up, and then that little latex balloon, actually it's probably latex free, pushes against your cervix to help open it up, and then usually it falls out once you hit about 3 centimeters. I looked at a bunch of studies for this article just because I was wondering how well it works. It shows that when used with misoprostol, it's the most effective, and the Foley balloon plus misoprostol means that you'll deliver your baby faster than if you didn't have it. Now, I've heard a lot of people talking about pain with the Foley bulb placement. A couple of things: you can always try and have it placed without pain medication, because a lot of people, it's just like a regular vaginal exam, maybe a little bit more comfortable, kind of like stripping your membranes. But if it's really uncomfortable, you can ask for something. If it's IV pain medications, those work very quickly. We could give it, we put it in, and then you just hang out until the IV medication's out of your system. I've heard of some providers offering like an oral pain medication beforehand, so I think it's great to talk with your provider about what you could do for pain management as they place it. A fun fact on this one: a lot of providers will place this like in the office the day before your induction to kind of help ripen your cervix, and then when you come in, we'll see what your cervix is at. We might start some misoprostol, or you might be ready to just start Pitocin. Most of all, you need to think of the Foley bulb as a mechanical way to open your cervix rather than a medical way. And I love that we're combining like a mechanical way of opening up your cervix along with the medical medication way of opening your cervix to help delivery be faster. We might get people out there saying, well, why does delivery need to be faster? And I am saying that if you're having an induction, the idea is to speed it along as much as we can. A lot of people are uninformed about how long the induction might take and how painful it might be. So when we can speed it along, I think it's a good thing. But you can always tell your doctor it's not for you. You want a slow induction and see what they say.